Hi, SmartPak fans. I'm Dr. Lydia Gray, the Staff Veterinarian Research and Medical Director at SmartPak. Today we have a very special guest and friend of the Ask the Vet show, Dr. Frank Andrews. He's from Louisiana State University School of Veterinary Medicine. Dr. Andrews, thanks for joining us. And first of all, how are things in Louisiana? I know that's a hot spot.
Yes, actually, Baton Rouge, we have quite a few people that have been positive for the test. And then, of course, New Orleans is a very big hot spot.
Right.
So we're really struggling here in Louisiana. We're all staying at home and staying healthy. So,
Okay.
they obviously recommend that you don't go out unless you absolutely have to. So,
Well, thanks for joining us today from your home, it looks like. Before we get started, I wanted to share with everyone all your titles and credentials. So here we go. See if I get this right. You're Professor of Equine Medicine at the LSU Vet School. You're board certified in Equine Internal Medicine. You're Section Chief of Equine Medicine there. And you're Director of the Equine Health Studies Program. Did I get all that right?
that's correct.
Okay, so I'm going to go out on a limb and say that you're pretty qualified to be answering coronavirus questions.
Yes, as much, at least on the horse side.
Okay, all right. So without further ado, there have been a lot of questions about the horse coronavirus, as you said, and the human, and how it affects horses. And so we're going to get to those questions. Question number one, can the coronavirus that is infecting people, so the COVID-19, also affect horses? In other words, can my horse get COVID-19 if an infected person handles him?
Okay, probably the best answer is maybe, but we really don't know at this current time. So there's been a couple of studies, actually in Belgium, a man was positive for COVID-19 and he infected his cat. And his cat got a little bit of a respiratory infection and then the cat was fine. It took the cat about 10 days to recover, but there wasn't any issue. The cat didn't have to be on, any kind of respiratory assistance or anything like that. So, and then there have been some studies looking at the effect of ferrets in ferrets. So it looks like ferrets and cats can get infected from people, but we don't know about horses. And we can talk a little bit later about the coronavirus that infects horses, and it's a different strain, a completely different strain than the COVID-19, which affects people. So it's likely that the COVID-19 would not, cause much of a problem with horses.
Okay.
So probably you're not going to get it from your horse, and your horse.
All right, that's very helpful. Thank you. So moving on to question two, can I get COVID-19 from my horse? And is it possible for my horse or items at the barn to spread COVID-19?
Okay, it's likely you couldn't get COVID-19 from your.
Could not get?
Could not, yes,
Okay.
could not get COVID-19. One of the things they have looked at is virus shedding in the cats and ferrets. And also there was one dog that had a positive antibody test.
That's the one in Hong Kong?
Yes,
Okay.
yes, was positive for the antibodies to the COVID-19, but they didn't find any shedding. So, but it would be unlikely because the shedding of virus would be very low in those other species.
Okay,
But
great.
that's
And
kind
then-
of with one caveat. I'll put one caveat in there. Most of these viruses, like the COVID-19, they start out in say a bat, is what that they think that started out in.
Right.
Virus, there's evidently there's sometimes 20 or 30 viruses that live in bats, and then those bats might bite another animal like the cervid, which is kind of a cat-like animal with those big eyes that live in the east in China, and those animals they're the ones that shed the virus, or they are the ones that infect people. So they have to go through this intermediate host. So it's unlikely that the horse would be that intermediate host.
Gotcha.
So they're probably not going to infect people.
Okay. And then to the second part of that question, is it possible for my horse or items at the barn to spread COVID-19?
So it wouldn't be possible for your horse to spread the COVID-19. One of the things that we are concerned about, if you've been diagnosed with COVID-19 and are shedding virus and you go out and work with your horse, then you could actually spread the virus on the grooming equipment, hoof picks, and then maybe water buckets, and then as
manure forks, brooms,
yeah,
anything
the
you
forks,
handle. Yeah.
and then the person who comes and cleans that stall, if you're not the one that cleans your own stall, then they could be exposed to the COVID-19 that you have. So we do recommend if you have COVID-19 that you stay away from your horse because
Okay.
it could
That's why many
spread
barns
it,
are closed right now.
as a fomite, right?
Yeah, great. So the next question, number 3, do horses get some form of coronavirus? And then I'm pretty sure this person asks, I'm pretty sure there was this outbreak of coronavirus in my horse's barn last year. Is that possible?
Yes, horses have their own strain of coronavirus. Again, it's a different strain than COVID-19, but it does cause primarily diarrhea in your horse. And so what you would notice is a horse that's off feed, and they do get a fairly high fever, 105 fever. So if you have a horse that has a high fever and that has, is off feed, and then they develop diarrhea, then it could have the coronavirus that is, causes that disease in horses. But again, it's a different strain than in people. And so your likelihood, and it is one of the things that is different is that it is a fecal oral transmission. In other words, you have to, if another horse could get it, but they have to be exposed to the diarrhea,
Okay.
and they do shed the virus in the diarrhea.
So the handling of manure then would be very important in a situation where a horse had the equine coronavirus.
Yes, at LSU, if we have a horse that comes in with diarrhea, we immediately put them in isolation. So
Okay.
that's the thing. And what they do recommend in barns, if you have a horse with diarrhea, to make sure you move it to the end of the shed row, at least 2 stalls away from another horse, and then clean that stall at the end after you've cleaned all the other horses' stalls.
And I'm assuming contact your regular veterinarian right away for their help in diagnosing it and treating it.
Yes.
And yeah. Okay. So question 4 then is very important. What should I do if I think my horse might have the equine coronavirus?
If you, number one, if your horse has a high fever, you would do a high fever, maybe off feed, and has diarrhea, and you think the horse has coronavirus, then I would call your veterinarian immediately. And then I would also, your veterinarian may recommend that you save a manure sample from right away, because you want a fresh manure sample. And then you can send that, your veterinarian can send that to a laboratory, either UC Davis or Cornell.
Right.
And Cornell, they can, or UC Davis, they'll do what they call a rapid PCR test. So that's a laboratory test similar to the ones that they're using on people. And it actually measures the RNA in the coronavirus. And it tells you if the horse is shedding coronavirus.
Do you know what the turnaround time is for that test?
It's 24 hours is what they give us. We send it in Federal Express to the, and then the lab runs the test. Usually the test is about 4 to 6 hours, but the results usually don't come until the next day.
Wow, that's pretty fast. All right, moving on to the next question, is question 5. Should I keep a routine appointment for my horse that was already scheduled with my veterinarian, like his annual Coggins, physical or dentals, spring shots, etc.? And also, should I keep my regular farrier schedule for trimming and shoeing?
So this is something that you'll have to discuss with your veterinarian. So there are most veterinarians, since it's considered, at least in the state of Louisiana, veterinarians are considered essential. And so they can still look at cases, they can still do routine appointments. So you would have to check with your veterinarian if you've already scheduled, say, a Coggins or a health certificate or vaccinations. Check with your veterinarian and see if they're still looking at routine appointments. The only caveat in that is that if your veterinarian has, the COVID-19,
Right.
and it comes up to your farm, then it could spread to other people, especially in contact. So you want to maintain your distance from anybody who comes into the farm. So that would be something that you would want to consider. At LSU, we are on emergency only and then also timely appointments. So if we had a breeding, a breeding appointment where we had to check a mare for follicles, and then we're doing AI, then we're maintaining those those appointments. But we unload the horse and out in the parking lot, and the people that own the horse, the clients, they stay out in the parking lot.
Okay.
So a little receiving area out in the parking lot, or they just stay in their truck. And then we bring the horse in. We do whatever we need to do to the horse. We're using gloves and masks when we pick up the horse, and then we go ahead and examine the horse to do the vaccinations if it needs to be done, Coggins, and then we return the horse to the parking lot, and then give that horse back to the client. So
so that's things that can, like, routine
exposure.
Preventive wellness care that can wait a month or two. But what about farrier? I mean, if you've got a horse that's barefoot, you might be able to rasp and do it. But if a horse is shod, what's your advice?
So again, that type of thing would be best discussed with your local farrier. Again, there are farriers that are continuing to provide services because, again, horses, especially in Louisiana and other places, they have to be shod in a particular time frame. Maybe these horses, have foot problems, corrective shoeing, things like that.
Right.
Some of the farriers are working and will provide shoeing services. But again, check with your farrier to see if they're still looking at routine appointments. And then keep your distance from anybody who enters the barn. So again, social distancing is very important.
Okay, great. And then moving on to our last question, number 6, what should I do if my horse becomes injured or ill or has an actual emergency during this time?
So emergency cases, since veterinarians are essential, emergency cases, at least I feel, should be seen by the veterinarian. You may have to call your veterinarian first, and if they're not doing routine or emergency calls, they would likely have another veterinarian that's available to look at your horse. At LSU, we are on, like, as I said before, we're on emergency basis only. But if somebody calls and says maybe that their horse has colic, and then we will have that horse come in. We also have an ambulatory service that goes out and looks at horses, again, maintaining the social distancing that we have mandated by the state, the state of Louisiana, and certainly other states have mandated that also.
Yeah. But
emergencies have to be seen, and we don't want any horse to suffer. So we recommend that those horses be seen. But again, you have to discuss it with your veterinarian.
That's right.
Handle that. And one of the things we do recommend is, if you have horses, contact your veterinarian now so that you know exactly, what their plan is, and you have a plan. Because during an emergency, sometimes, you don't have time to wait.
Right. No, that's very good advice. Well, those are all the questions that we had for today. And thank you, Dr. Andrews, for joining us.
Well, thank you, Lydia, and I appreciate it. And everybody stay safe.
Yeah. We're going to add some links, I think, to the description for where you can go for more information, some resources for you. And then Dan and I will be back later this month for the regular monthly Ask the Vet video. But in the meantime, make sure to share this video on social media and help others with this information. And then thanks for watching. And like Dr. Andrews said, stay safe, everyone.